Here's my 5 cents worth on revision bariatric surgery. It's a slightly tricky topic, but one I'm relatively familiar with. I see quite a few patients in my practice who need revision surgery after having bariatric surgery in the past. There's a number of problems people come with. Food intolerance, reflux, and weight regain are probably the most common. The types of revision surgery that I do most commonly are removal of a gastric band. That happens all the time. There are loads of people out there with gastric bands that have stopped working and they find them annoying, and they often have intolerance to specific types of food. And it's relatively straightforward to just remove a gastric band. It's a quick and easy operation, is often done as a day case. It gets a little bit more complicated when I see patients after they've had a sleeve gastrectomy, and they commonly come with either intolerable reflux or weight regain. Reflux is not an uncommon problem after gastric sleeve surgery, but it can be made better usually by taking medications. If it's not, then a conversion to a gastric bypass is a very reliable fix for that. Weight regain is a little bit more tricky. Certainly revising a sleeve to a 1 anastomosis or a Roux-en-Y gastric bypass does work. The weight loss is not as much as it is after a primary operation, but it is still worth doing for many people. These operations require quite a lot of experience because they are often in an area that's been operated before. They need to be approached with a little bit of care, so preoperative tests are often important. Things like a telescope test to evaluate the sleeve, or a dye study where patients drink a bit of contrast so we can see whether the sleeve is stretched or whether there's a hiatus hernia present. So there are plenty of solutions out there for food intolerance, reflux and weight regain. You need to approach those things with care and consideration, and you need to have quite realistic expectations about what the outcomes can be, but often those problems can be fixed.